Hi everyone, I'm Charlotte Kilpatrick reporting for Vaccine Nation from the World Vaccine Congress in Washington. Today I'm delighted that we're joined by Dr Yewande Alimi from the Africa CDC. Thank you so much for your time. Would you kindly start off by just introducing yourself and the role that you currently play?
My name is Yewande Alimi. I'm the One Out Unit Lead at Africa Centers for Disease Control and Prevention. Africa CDC is Africa's foremost public health agency of a political institution, the Africa Union. So we cater to all 55 member states of the Africa Union, ensuring that Africans are safer and healthier. It's lovely to be here.
Fantastic, thank you so much. So could you just give us an idea of how great or significant the burden of AMR is for the continent of Africa and why it's a problem?
Antimicrobial resistance remains one of Africa's biggest and greatest challenge. And beyond Africa is considered one of the global top health priorities across the globe. In Africa, for example, we currently bear the highest burden of AMR across the world. What does this mean? I think it means that many more Africans are at risk of drug-resistant infections, means that many Africans who don't even get enough access to drugs the drugs available could potentially stop working for a lot of infectious diseases. And as you know, Africa also bears the burden of very highly infectious diseases that really require these antimicrobials. So looking at the burden, for example, the recent sort of Gram study that in the global burden estimation really shows that almost 250,000 people are dying a year attributable to antimicrobial resistance. To bring it a bit closer to home in a very more practical way, because oftentimes when you state numbers, it's difficult to really put into context. What this means is the big three, the HIVs, the TB, the malaria, that we have known for decades and decades as the greatest killers across the world. AMR is already surpassing the numbers of deaths attributed as a result of this. So in the work that we continue to do at Africa CDC, beyond also that, we were able to do a multi-country, a multi-year study, and it's really shocking findings around the drug-resistant patterns that we are seeing in the member states. But I think one of the most important things that is concerning, particularly when you think about lower middle income settings, is the unique challenge when it comes to antimicrobial resistance. More often than not, a lot of people think about antimicrobial resistance as overuse. Yes, it's driven by overuse, but there are also other complexities when you think about the health system. For example, the child in the most rural part of the world that requires a certain antibiotic, when there is no access to that antibiotic, doctors and clinicians are forced to the only options that they have. This could potentially drive drug resistance. Think about things like infection prevention and control and wash strategies. Think about things like vaccines. I think this is an interesting conference, and this is why this is quite relevant. I'm jumping into the next. I am just going with the flow.
Go with the flow. That's absolutely fine.
So more often than not, a lot of us, yes, indeed, we need things like improved surveillance. We need the laboratory capacity. We need behavior change to ensure that people are using the right dose of antibiotics. They're sticking to the prescription from physicians and healthcare workers. On the agriculture side, it's not used as a food promoter or growth promoter, as you may know, or used in improving the weight of the animals. And also things like waste management in hospitals. Those are really important layers. But I think one of the things that we are starting to look at now is how can we ensure that we reduce the need for antibiotics? How can you do that? As I try to explain, a lot of the infectious diseases are caused by bacterial pathogens, fungi, or viruses, which require some antifungal, antibacterial, or antivirals, which all come in together as antibiotics. But if we're able to reduce infections using vaccines, means that the average person doesn't need to take that cephalosporin, doesn't need to take that penicillin. And think about this as a cost-effective mechanism. And we know that many people might not be able to get access to new antimicrobials that will be produced currently in the pipeline because they're very expensive. It's very expensive to discover new antimicrobials. But what if we potentially raise investment in preventing infections? think about it in a holistic One Health approach, be it vaccines for agriculture to ensure that animals don't get sick and therefore farmers don't need to use antimicrobials. But think about babies, think about women, and think about a lot of the population that are in very limited settings that don't have the right stewardship programs, the right infection prevention and control programs. What about if we try to reduce infections, and think about it from a population sort of setting, means that it gives herd immunity. If I'm able to invest in one patient, I could potentially prevent an outbreak that would require use of antimicrobials. So I think more than ever, use of vaccines, immunization could be a potential game changer. One of the things that we continue to champion at Africa CDC is equity. I think more often than not, the work that we have done around COVID-19 shows a very jarring global equity around access to not just vaccines, but therapeutics and diagnostics. So one of the things that we have done at Africa CDC is really change the landscape of what the ecosystem looks like in local manufacturing. We have been able to leverage our political mandate to ensure that the heads of state are able to make an informed decision, domestic financing, resource mobilization for local manufacturing. So through the work that we've done, of course, we've been able to establish a few regional hubs for local manufacturing across the African continent. We're quite proud of that story. Through international collaborations as well, we're starting to see the progress for vaccine manufacturing, market shaping, but also ensuring that there are regulatory mechanisms in place. I think more than ever right now, the challenge we're seeing with antimicrobial resistance and the vaccines available for some of these bacterial infections is despite the progress that has been made in producing them. When it comes to efficacy and thinking about things like clinical trials, the African continent is not very well represented. So more than ever, I think for us to be able to see the value of vaccines to reduce infections and potentially reduce antimicrobial resistance, we really need to close that gap, ensure that we have a bit of equity. We ensure that there are international collaborations, as we've seen with the success of the COVID-19 vaccine, in looking at some of these relevant vaccines for antimicrobial resistance.
Fantastic. That was such a comprehensive overview. Thank you so much.
Yeah.
So you've touched on a little bit what Africa CDC's sort of strategy is. Can you tell us a bit more about this in terms of vaccines and AMR?
Okay, sure. So in terms of what we do, I think our strategy for antimicrobial resistance is quite broad, and knowing that AMR is very multifaceted, it's not one sector only. It requires a One Health approach to addressing it. So we've taken it from the lens of ensuring, first of all, we're able to estimate the burden. If you don't know what you're sort of addressing, you can make any real life progress. So we have made investment, capacity building in countries to strengthen their surveillance for antimicrobial resistance, but most importantly, consumption as well. We've also set a mechanism for improving the use of the antimicrobials. So we have a lot of work around stewardship, ensuring drugs are available at the right time, and ensuring access. We're doing a lot of work around improving diagnostic laboratory capacity. But allow me come to one of the ones that I'm quite passionate about, is really preventing it in the first place. Reducing infections will be able to reduce the use of antimicrobials, which ultimately will be able to reduce the risk of these pathogens developing resistance. So what we have tried to do is put in interventions, flagship programs that look at sort of preventing the infection. So we have some work around infection prevention and control. But most importantly, one of the things through the sort of the new landscape for local manufacturing is really the use of vaccines to reduce sort of infections at source level as well as community, but also thinking about it in the holistic One Health approach, so also supporting the agriculture sector. So that's the work that we are doing around vaccine. And I think one of the things we are also good at is the advocacy. Now, more importantly, I think there is the evidence there, but why are we not making investments towards rolling out vaccine as an important strategy for reducing antimicrobial resistance? So at Africa CDC, that's one of the things we're trying to do in trying to understand the economic value. For every penny spent, what is the amount of lives that we could potentially save? And really this would be able to drive how research is advancing, but most importantly, how we can advocate better for equity of available vaccines to African continent.
Fantastic. It's wonderful to hear the passion when you're speaking about that. And you've mentioned some of the reasons that Africa CDC is valuing advocacy, and it's great to have the team here again at the Congress. Can I ask you what you hope to achieve by attending the event and what you looked forward to most?
So for us, one of the things that we hope to, like we always champion, I think, within the global health settings is equity for low and middle income countries and championing equity access to the relevant vaccines at the right time to the right population. So one of the most important things is researchers, big pharma companies are doing remarkable work, but they don't know the right place to look when it comes to collaborating with the African continent. This is why Africa CDC is here. We are the custodians for 55 member states. So we have learned to work with countries. One of the things, and we continue to champion, is our new public health order. How can we ensure that we have stronger African institutions, such as the Africa CDC, such as the Africa Medicines Agencies, but most importantly, at national level, how can we ensure we have strong national systems? Think about the National Public Health Institute, think about the NRAs within the countries to ensure right regulatory frameworks are in place. We're also passionate to ensure that we expand local manufacturing beyond vaccines, thinking about therapeutics, diagnostics, and ensuring they're the right quality, affordable to every African, so that we can really ensure that the availability of these vaccines are there. In addition to that, I think it's also domestic financing. So more than ever, that's one of the things I was able to say, how do we bring this research to be able to guide policy? How do we advise to say it's important for every country to invest a certain amount for vaccines relevant to antimicrobial resistance as an effective intervention to reduce the burden of antimicrobial resistance? And I think lastly is around, most importantly, this conference gives us an opportunity to meet the right partners, the right stakeholders. At Africa CDC, we continue to champion an action-oriented partnership. You know, interventions need to be context specific. Interventions don't work unless it's relevant to the right people. So one of the things we continue to champion is action-oriented partnership, where we are able to achieve the shared outcome, which is really ensuring that we have a safer and healthier Africa.
Wonderful. Well, it's such a privilege to have you here, and thank you for joining us.
Thank you.